Thank you so much to Rod, to John Gordon Stewart, 1031 Unchained, and Sound HSA. This is a very important time, and I'm so glad to be here, and really glad that you could all join us as well. Why don't we start with just a few brief introductions? We'll start with Dr. Amus down at the end. How did you get to this incredible spot where we're at right now?
Yeah, so I'm a physician. I'm a primary care physician. Hi, everyone. I'm a hospitalist, internal medicine physician. I work in Boston. Since medical school, I sort of realized that the medical system is broken and it doesn't really work to help people. And it was around the same time that I got into Bitcoin. It was around the same time my brother was writing the Bitcoin standard. So understanding both at the same time, you understand a lot about why medicine is broken when you understand why the money is broken. And my mission is to try and raise awareness about this.
Brilliant.
Yeah, thanks. I'm Dan Ostermeyer. I'm an emergency physician in Houston. I work for the University of Houston. I also run a metabolic health practice on the side. And I mean, you can really trace the root of pretty much the entire system to our metabolic dysfunction. And that is really sort of the most first principle core problem with humans these days. And you know, if you can fix the money, fix the world, you could probably fix the metabolic health and fix your body.
My name is Mark Stefani. I'm a hospitalist in Minneapolis and the president of the Bitcoin Physician Network, which we just launched a few months ago with a few of these other individuals in the room. And just for a brief example, similar to Dr. Ramini's, I had asked my health system if I could be paid in Bitcoin about 5 years ago or so. And the answer was no. And they asked me why. I went through all the reasons. Now my health system is being bought out by another one because you know they can no longer afford to continue to function as they are. And so as we're seeing a lot of these mergers and acquisitions, taking into account an asset that might have prevented that in the first place would have perhaps behooved them back in the day.
Thank you. My name is Abel James Bascom, and I've had a podcast for almost 15 years now, primarily in health and technology, interviewing doctors, scientists, athletes, and the longer that I've done it, the more expansive the conversation has needed to be. I've been a Bitcoiner for some time now, but mostly disenfranchised with the Fiat system and the downstream implications of that in the food system. I started off as a management and strategy consultant, working with private industry and the government, and learned pretty quickly working with the Department of Education that food is the biggest lever for schools to attract students who will ultimately graduate and have good outcomes, and also dramatically change the outcomes of their health down the road. And so understanding that that's a lever, and also looking at what's happened with debasement and affordability around that, it's necessitated the conversation about sound money. And you can't have sound health extrapolated over a lifetime without sound money. So let's talk about some of the issues with the misaligned incentives first, starting with how is fiat inflation and centralized financial control created misaligned incentives throughout the value chain of health care? And we'll start with Dr. Amus.
I mean, I think we have to go all the way back to why is the system the way it is right now. And you have to go back to the formation of the American Medical Association in 1903 and why a certain cartel took over medicine and decided how physicians need to practice, who gets licenses, how we're going to restrict the supply of physicians. All of these things started around 1910. Around 1913. What happened around that time? The Federal Reserve was created. So to have a government that's so powerful that it be able to control something as big as what a random physician in Kansas is doing, the only way for government to get that big is for the government to have the financial ability to print money out of nowhere. And this is where our medical system got captured. And when you have a centralized authority in control of a system, that authority is very easily captured. And that's what happened in 1910 when it was captured by the pharmaceutical industry with the Flexner Report. So everything starts from, we have unsound money, we're able to print money out of nowhere, and that allows this monster to just grow and grow and grow and keep growing, and up until to the point right now where medicine is modern medicine, pharmaceutical pills are the third leading cause of death in the U.S. And that's the root cause of the problem, I think.
Yeah, I mean, healthcare really shouldn't be a thriving industry. It really should. I mean, well, sick care is a thriving industry because there's a continuous stream of people to participate, and very few diseases are actually cured, especially with the increase in chronic diseases. And so diseases are managed, and managed diseases are managed with interventions that, given their incomplete understanding of the way the human body works, often have long-tailed adverse effects. And so a long-tailed adverse effect is a pharmaceutical company's favorite adverse effect because it's very difficult to pin to the therapy. And if that adverse effect then begins to manifest over time with an increasing rise of a particular problem, maybe a cancer, maybe a debilitating musculoskeletal problem, then a new intervention can be developed to manage that long tail effect, which may also have its own long tail effect. And so, a sick care system is a very good business, but a healthcare system really is not. And so a healthcare system should, in theory, if you're paying for healthcare, you should use it less and less over time. You should age gracefully and then just die. There should be no increasing spending as an elderly individual because you still have solid bone density and mobility and fitness and mental health. And in the past, that was the trajectory of humans. But if the root and the core of an individual's biology is dysfunctional from a young age, then the sick care system does thrive. And so in theory, healthcare should defund sick care, and really, in theory, we should use less and less healthcare in the future if we actually made people healthy.
Yeah, I'll steal one of my favorite medical terms, and that's multifactorial. I think the explanation is multifactorial, meaning several different explanations. Monetary debasement, our monetary policy being one of those. I do think it starts off, a century ago when modern medicine evolved out of what was referred to as therapeutic nihilism, where we had no real treatments to help treat disease. And as pharmacotherapy did become more efficacious, as surgeries became more efficacious, and practitioners felt like they could actually offer help to their patients rather than just being at their bedside providing comfort, that obviously led to the belief that we could cure all disease. This stemmed from a lot of the Industrial Revolution in reducing the body to minutia and very granular understanding that if we could identify this solitary physiologic process, we can turn and find a drug to treat it. And so that approach was how medicine and science behind pharmacotherapy advanced over the decades. We always knew that how we live, our lifestyle, was a tremendous importance to our health. But there was always the understanding that the medicine and treating disease would be more of a priority. And so you pair that then with our now understanding that we're not curing all these chronic diseases, diabetes, high blood pressure, hypertension, coronary artery disease. We understand that those are more of a product of our lifestyle and that new medications are not going to fix that. So then you add on top of that decades of easy money, easy credit for systems to be able to build out the huge administrative base for all of this, that you could chase new healthcare initiatives and expansions, all while not having to ask, is this providing more value for the patients? You didn't have to ask that question because money was cheap. And so you pair that then with recurring revenue stream, chronic disease, and it's inevitable that you're going to be faced with misaligned incentives that Stu laid out in his slides from the beginning.
And maybe if you could just continue, Mark, and then we'll go down the line. What are some of the clearest pieces of evidence that you're seeing in the system right now that optimizes for volume and revenue instead of actually healing and wellness?
I don't think you have to look any further than the fee-for-service model. And it's not what Dr. Link was. He's a private practice dentist. He can determine how much he wants to see, how much he doesn't want to see. And the healthcare system, as employees of the health system, we're in essence told how much we're going to see. And so that throughput is what is optimized for. The quicker I can get a patient in and out of the hospital, the better off the hospital system and their bottom line is going to be. They've tried other models like value-based system, but look who's missing from the value-based system, the patient. It's not about what the patient values. If your value is met, do you get to reduce that from your, if the value is not valuable to you, do you get to deduct that from your bill? No, of course not. So the value-based payments that they've tried have not been beneficial. Then there's bundling payments, which have been shown to be beneficial for, say, orthopedic procedures, but have not been shown to reduce costs for things like heart attacks or sepsis, other medical conditions like that. And so it's that throughput that, in essence, is what's driving it.
Yeah, the throughput is really a side effect of the fact that there's inflation, and so it doesn't really, I think, it doesn't stem from the healthcare system itself. It just stems from the fact that there's an increasing demand for more and more dollars to feed the system, which has, unfortunately, healthcare can't scale because it's mainly human-based. There's not a lot of technological advances that can remove the people that need to provide the care. And so because it's a non-scalable system, it's one of those systems in economics that doesn't experience a lot of the same deflationary forces from the human side. From the device side, sure, things should get cheaper. From the ability to make pharmaceuticals, that should get cheaper. But because more and more people need more and more care, you also need more and more healthcare nurses, mid-level providers, physicians, and all of those things don't scale. And so there's a continuous desire to push more dollars through a system that doesn't always benefit from a lot of the technological deflationary forces that other systems benefit from.
Yeah, very important to point out, and I learned this stuff from Andy, but patients in this system are not the clients. Patients are the product. Whether the patient does well or not is irrelevant. What matters is how much money we can make off of them. Everything is paid by a third party, and the third party cares to make more money off this patient. And so it's all about making more money. It's all about trying to fight inflation as much as we can, and never is the patient's well-being taken into consideration.
I want to briefly just echo what he's saying. I know that may seem shocking, but it in practice is true. And I think what is exemplary of that is the fact that health systems that I've been a part of don't really care about the type and quality of physicians that they're hiring. They're more eager to replace with somebody who they know they can lowball in salary rather than a quality physician who is going to provide value to the patient directly. And this idea, again, of quality measures, who gets to determine what that measure is? It's not the patient. When was the last time you were asked how good your quality of care was? And how did that get manifested? How did that change anything thereafter? It hasn't. And so I find a lot of it to be lip service, which is obviously sad, but that's why we're here.
Unfortunately, I have personal, intimate experience getting sick by trying to be healthy, following my doctor's advice in my early 20s, trying to prevent a family history of heart issues, high blood pressure, and that sort of thing. Over the course of the next 18 months, trying to eat zero dietary cholesterol, giving up red meat, ultimately led me to gain 30 or 40 pounds and develop all of the same symptoms we were trying to prevent. So thankfully, that happened to me early enough that I got mad enough to kind of start writing about it and exploring this more, and also taking that agency back, which I had largely outsourced. So maybe we can talk about how there are multiple profit centers here. There's the ultra-processed foods, there's the pharmaceuticals, and then there are the procedures, and each one of these kind of feeds into the other, so to speak. So, Dr. Moose, maybe you can just rant on that for a bit.
Yes, my pleasure. So, from the food perspective, again, going back to the inflation issue, is the government's always trying to hide inflation. They don't want us to know that they're printing money. They don't want us to figure out that things are getting more expensive. So one of the ways they do that is, let's recommend that people eat cheaper things so that they don't notice that the ribeye is no longer affordable. So have one of those soybean burgers instead of having a ribeye. You won't notice that it's 1/10 of the price. And so that, it's been going on for a long time now, where they've pushed us away from the foods that our ancestors used to eat towards cheaper, more processed foods to try and hide inflation. At the same time, that also helps their friends in big agriculture and the processed food industry. And it helps the medical industry because it's making all these people sick. And a lot of these food companies are also owned by pharmaceutical companies, so they benefit on both sides. And so the money is definitely a root cause of this. And yeah.
The nice thing is, though, I'm not particularly sure Bitcoin will fix the healthcare system, but what will fix the healthcare system is the coming implosion of cost. Because think about, most, 30-year or younger people. They do not have a lot of full-time job prospects. They do a lot of part-time, they do a lot of gig work, they're in between jobs sometimes frequently. They are not people who have employer-sponsored healthcare plans. They are people who are just not participating in the system. And by not participating, they're not feeding the ever-increasing insurance premiums, which is ultimately the customer for most healthcare systems. So by not feeding into the insurance premiums, they're not feeding the ever-growing sick care system. And they're also forced to think about how they can avoid not getting sick so that they can avoid the catastrophic emergency that they are sort of baseline aware of and somewhat uncomfortable with. They're not on their parents' insurance plans anymore. And so the concept of people being outside of the system is increasing, and that is because of the cost, and people can't hire full-time employees because in many industries, if you have too many employees, you need to have mandatory healthcare coverage for them. And so all of those things ultimately have broken the system. And so because the system is broken and increasingly expensive, it will just fix itself by its coming implosion. And that, I think, is very hopeful.
We're not here to fix the system, we're here to break it.
With regard to the process, clap for that. Processed food is a product. It's not food, and it's marketed as such. And there's something called the time price of food, meaning that as an individual, you're more likely calorie for calorie. If the dollar amount is the same, a family is more likely to opt for the food that takes less time to prepare than they would one that takes a longer time to prepare. And that's a relatively new phenomenon. You have to ask yourself, why would somebody opt to do that? And the answer is relatively obvious in that that time they believe is more valuable spent elsewhere, whether that's working a second job or trying to make more money doing something else that takes less, puts less impetus and understanding that sitting down for that 1 hour meal with your family, eating whole foods, is more beneficial for you, which kind of leads to the second variable, and that's it's very much a real phenomenon where the higher the inflation, the more likely you're going to make poor choices now rather than thinking about your future. And oftentimes that's manifested in how we treat our finances, but it also has been demonstrated that with higher inflation, you see increasing rates of obesity and metabolic syndrome. So people are choosing these ultra-processed foods because they're quick, and they're cheap, but they are not food. And I think that's, if we take away anything from this, our panel discussion here, is that when you look at your finances, you need to use the same lens to look at your health. And prioritizing your health now is important as it is as looking at your future in finance, because it's the same amount of emphasis on the time that you have and the quality of that time into the future.
What are some examples that you all have seen from the centralized system optimizing for scale and volume and shelf life over patient or individual outcomes?
From a food perspective, the food industry, or from on the hospital side?
Metabolic health in general.
I don't think you have to look any further than the ultra processed food industry. Again, the fact that it's marketed as food, it's an industry, it's a science on its own. Like they are wanting you to eat to become addicted to these products. It is not food, and it's hard to blame individuals for this, because again, if you can't afford anything more, what do you expect? And if you're told that it's relatively healthy for you because it's low carb or low fat or high in protein now, okay, well then it's got to be good for me. It's bright, new, and shiny, and Oscar Mayer is telling me that it's good for me, or whomever, and people don't have the time or understanding to think more about that. Again, it's challenging to see that day in and day out, the same patients, the same chronic conditions, every day in the hospital. And that was a big part of why Bitcoin has become so important to me, and wanting to build something outside of this is seeing that it's not going to change from within. That's very much a Jeff Boothism, is we're not going to change the system within the system. We have to create something outside of it and align the incentives that we want onto that new system, defining those up front and building that with patients at the forefront.
Yeah, I like to think about it as just go to first principles. Like the human genetics are very stable. We're not turning into mutants. We're not evolving into a new species faster. But yet we see all of these conditions that we often attribute to genetics of cancer, the genetics of heart disease, the genetics of hypertension, the genetics of obesity. We talk about this colloquially without actually thinking what that means. And it is totally antithetical to knowledge that we have stable genetics, but yet we attribute an increasing prevalence and incidence of disease in relation to our genes, which are not really changing, very stable. And if you think about health from a first principle standpoint, you then have to ask, well, then what is changing around us? And I think that answer is very obvious. There are many environmental conditions that we create. There are many things we consume. We're probably the only species that's both smart enough and dumb enough to try to invent our own food and then eat it. And so if you think about health from a first principle standpoint, it becomes very obvious that the problem is at least a large part food, maybe not entirely, but it is not what we're often told, which is that it is from within us. It's what we are putting within ourselves.
Well, that was the slide that Stu had up initially, and most people, especially the older demographic, will think that there's nothing that they can do about their health, that it's all genetic, it's all predetermined. My dad had heart disease, etc. And that's not true. The data supports the fact that it's lifestyle changes are the bulk of what determines our health.
Yeah, and the people we grow up with influence our lifestyle, which then makes it seem as if it is a genetic component when it is in fact not.
Yeah, again, all this misinformation is on purpose. Harvard nutritional guidelines, Harvard nutritional advice is all faulty. It's all based on shabby research, and it's all funded by the processed food industry. And they've done humongous work convincing people not to eat what their ancestors have been eating for hundreds and thousands of years. Over 100 years, they've changed all of this. And the shift that we've had is quite incredible, and it can only be done in a system that's financed by fake money, and a system that's centralized, a system that... How could you change what everyone eats in an entire country in 100 years to such drastic effects on our health? And that is Fiat.
I was getting my steps in yesterday. John encouraged me, and so I was pretty hungry. And then I saw that there was a local pizza shop close by, and so I looked to see if they had a gluten-free pizza. They did, small, and it was going to come out to be like $35 before delivery and all those charges. And growing up, I thought that was something that everyone could kind of eat, and it was. But lots of things have changed. So. Thankfully, I found a food truck, a more decentralized solution, and got a carne asada steak for $10. It was delicious. So let's transfer and transition to talking about some of the solutions. How can sound money and decentralized systems start to correct course for practitioners and patients alike?
This isn't meant to be a contrarian take, but I don't believe it does. I believe we do. This is first and foremost an individual-led grassroots effort. And so when we talk about the misaligned incentives that we laid out earlier, let's examine those and then define the ones that we do, the values that we want to incentivize. And I think if it's not clear from this panel, we want to incentivize our patients and individuals to prioritize their health. I consider revolutionizing healthcare not needing us, right? That's the revolution. It's not some new app. It's not some new device. It's not needing our care in the first place. And that starts with encouraging, incentivizing, and building a system that can allow for that, because behavior changes is incredibly hard. And the food industry has nailed that to a science, right? And so it's incumbent upon us as individuals who don't believe that a centralized authority can handle such a complex system as we have outlined, that we build a system that we want to see. I think that's what we're trying to do with Bitcoin in the financial system, and I hope that we can do that within the healthcare system.
Yeah, the only way Bitcoin will fix healthcare is that people do not want to part with their money and pay for something that's not working. So if I continuously go to my mechanic and the problem that I'm paying to fix continues to exist at the end of my auto appointment, then it would be a complete embarrassment to myself and the mechanic that I'm continuing to pay him and that he is continuing to charge me and that we are going around and around in the system and that my insurance for my auto repair is continuing to pay for obvious either a lemon or a faulty mechanic. And so the only way that Bitcoin fixes the healthcare system is that the people who want to have their money under their own control and not spent on something that is essentially a failure. I mean, the healthcare system is an absolute failure. I live in Houston, and I think it's famous for having one of the largest medical centers in the country, and that is an embarrassment because that means that everyone is unhealthy. If there is that much business, that one of the largest employers is healthcare, or aka sick care. And so it fixes itself because no one wants to pay into it anymore because it just doesn't work, and they want to pay into something that actually does make them healthy.
One other way, I think, is there's going to be a lot of people dissenting against the system, speaking out against the system, and you're going to be less scared about people, the system confiscating your money, kicking you out from your clinic. You can't see patients anymore. We're going to confiscate your bank account. All of this because you have a direct peer-to-peer payment method. That's going to help people just break out. And I am okay with, talking shit about pharma online because people can still pay me in Bitcoin. So.
Yeah, and we're being a little. I mean, we're being somewhat, anarchistic, or a little anarchist about this, but. I mean, there will always be emergencies. People will always have emergencies. People will always need to go to a dentist to get the chipped tooth repaired. People will always have broken arms and legs. So there will always be sick care. It just will not be a growing industry. It will just be a stable baseline of the number of injuries that people experience as humans.
Yeah, I like to have people run through the exercise of playing out a counterfactual. Imagine over the past century that we prioritized what we already knew, that our lifestyle habits affect our health the most. What would a healthcare system look like if that in fact had been the case? And I would imagine you'd see much smaller orthopedic centers, you'd see much smaller heart disease centers, fewer cancer-related institutes, and it would be more along the lines of acute care, trauma-based, and the majority of the care that we provided would be urgent care, trauma-based again. And the role of the physician perhaps would have returned to how it started. And doctor means to teach, and we would serve as teachers and guides for our patient to maintain their health, not to maintain their disease. And I do see Bitcoin in a way being able to help that with other decentralized technologies like Nostr, communication protocols, to be able to foster that physician-patient relationship more, because a big part of the problem is information asymmetry. We hold a wealth of knowledge that patients don't, and you pair that with lack of price transparency and the inability to shop in the sense of an emergency. You're willing to pay millions of dollars to save your life, right? But you hesitate to pay $20 to go see the physician. And so Bitcoin can solve that in the sense of giving us more time to work with our patients, to narrow that gap of information asymmetry, to provide a network of physicians who are like-minded, not have to jump through hoops, to refer to somebody who might be able to provide further insight on metabolic health or cardiologist or GI issues. I could see that being a future we could build.
And just take for example, like the basic, like the most simplest system, a primary care system. Like the primary care doctor would simply be an educator, just like the traditional Chinese healer who was only paid when when the town was healthy, and then when the town became sick, they were killed. Because they obviously weren't working. But besides for that aspect of it,
we'll sign you up for that practice.
Yeah, I'll be the first on board. But really, it would be simple, and most of medicine would be on medical education and really on health education specifically.
Hopefully we can save a little bit of time for questions, but Mark, I want to make sure we talk about this. What is the mission of the Bitcoin Physicians Network, and also who are you looking to attract?
We're looking to attract like-minded physicians who are interested in Bitcoin, who are already accepting Bitcoin, who want to learn more about it. The idea obviously came from conversations like we're having today, and the initial initiatives are very simple. It's advocacy and it's education. But there are many opportunities for growth, and I think what we've discussed on this panel here thus far will give you insight as to what we're hoping to do. But further events like this, more conferences, more education. The website has built out this beautiful Bitcoin map that clearly drives people to practices that accept Bitcoin, and that's what we really want to foster. We want to have another layer to the Bitcoin network, and that's going to be a physician layer, that's going to be a meat space layer that we hope to attract more and more people to Bitcoin through offering services that we believe they will be grateful for.